guys, welcome to video 10. Hard to believe that we are already this far along. You guys are doing awesome. I'm really grateful that you have followed the course along to this point and sticking with it. We're going to be talking about warning signs. I don't know if you noticed the disclaimer down at the bottom of your screen, but I just wanted to re-emphasize that I am not a medical professional. This is not medical advice. This is just general information that can hopefully help you identify if your spouse or yourself are in danger. No matter what, I always encourage you to follow your instincts, and if you feel like something is wrong, call your provider. Even if you don't meet all of these signs, and even if everybody keeps saying, oh, it's fine, it's normal, if your gut is telling you something is wrong, follow that gut. Especially if it has to do with how often your baby is moving, because there is a general understanding of how often a baby should move in the womb, but you know your baby and you know what's normal, and if something seems off, like they're moving too much or too little, whatever it is, you let someone know, okay? It is always, always better be safe than sorry. So this disclaimer is going to stay at the bottom of the screen for the entire video because I want to be sure that you understand that this is not medical advice. You may have noticed that I have a call 911 or your care provider criteria below. If you like, you can print off that document to keep in with your birth bag or whatever, especially if you're going to be laboring at home for a long time or having a home birth. I think it's a good idea just to have that general information just in case something goes wrong that you or your partner might not recognize as a possible symptom. And some of them are very obvious. For instance, if the mother stops breathing or is unresponsive, call 911. Some of them are a little less obvious. For instance, the one I wanted to talk about was if you've been laboring and then suddenly you're having no contractions at all. And you also have this sense of panic or doom, almost maybe kind of like a panic attack or something like that, definitely call your care provider. It sounds super weird and vague, but is a potential sign of a uterine rupture, which is very, very dangerous, especially if you're at home. You need to get to the doctor as soon as possible. So, and that's the reason I created the 911 criteria, not because I'm a doctor and I know when you should go to the doctor, but because there are things that people might not automatically recognize as signs of something wrong and might not call their care provider or might not call an ambulance fast enough. So it's a good thing to look over and just have as general information. And like I said, especially if you're planning on laboring for as long as possible at home, then I strongly recommend you have it nearby, screenshot it on your phone or print it out so you'll have it easily accessible. Always call your care provider. Don't tell anybody I didn't call my care provider because it wasn't on Abby's criteria, okay? Again, this is not medical advice. And that's it for this video. I'll check you out in the next one.